So my name is Gerard Green. I'm one of the specialist pelvic health physios here in the clinic in Birmingham in the UK. And we are just after Valentine's Day. And it gives me a great pleasure to speak to my esteemed and brilliant colleague, Alina, who's also, in addition to being a wonderful person and wonderful friend and colleague, who is a brilliant, passionate, pregnancy, postnatal pelvic health physiotherapist. And myself and my colleagues here in the clinic kind of see the women that she looks after. And she makes a really amazing difference, not just to their condition, but also to their kind of enjoyment of life and quality of life. So we're here just for a couple of minutes to speak to Alina really about her postnatal trauma course. So we ran this for the first time a few weeks ago in January, and that filled within a day, which was quite amazing, and brilliant. And we're running it again, and it's almost full again this time. But I was just quite keen to really get Alina just to speak about what she's going to cover. So, Alina, brilliant to see you. Just
Thank you,
tell us what you cover on that course.
Thank you, Jared. It's very exciting. We're just after. I'm happy to be after the first one. It was really, really great. And I'm really looking forward to the next one. So it's there's always things to improve and to adjust. So I'm very excited. So I'm talking about the perineal trauma. I'm going to talk about all the oases and perineal tears, the elevator ani avulsion, pudendal nerve injuries. There's lots of material that very interesting stuff, anatomy around, and just understanding the conditions. I'm very passionate about helping all those women, and we're also going to talk about the SPD and all the pelvic girdle pain postnatally. And there's a lot of trauma that can happen, especially in these times with the pandemic, with with traumatic deliveries, and it's another subject we're going to touch. So it's very interesting, and I'm looking forward to see whoever is coming. I'm really excited to meet you all. So hopefully I'll see you on my course.
And I think what's interesting to me is we will see these women in clinic, and they will have had lots of trauma, and they may have had a forceps delivery, they may have had a grade 3 or 4 tear, they may have had a repair, but they may have obstetric anal sphincter injury. But a lot of the times, because they've also given birth and they have the joy of a newborn baby, they're really unclear as to what's happened to them. And the other thing that you sometimes find is that they've had lots of trauma, but they're waiting really for someone like you, Alina, or some other specialist postnatal physio to really explain to them, well, why have I got bowel symptoms? Why have I got urinary symptoms? Why am I having lots of pain? And why am I maybe struggling with symptoms of prolapse? Is that something you see?
Definitely. So some women come in with all these symptoms. So we might have some urinary or bowels. They might come together. There might be some vaginal flatulence. That's a new thing that's more talked about, and we're going to also cover that. And they really struggle. It can be very embarrassing, very upsetting in many ways. And I'm happy that I can and able to be in this position to help those women that come, and I'm happy that we have that opportunity in the private clinic to see those women. It's great that we have your clinic running and open, Jared. It's amazing.
And I think the other thing that people always ask me is, well, who is this course aimed at? And I think, obviously I'll ask you, but I think from sitting in on the course the last time, I think we probably have two groups. We have those very experienced pelvic health physios who maybe have done a lot of work in other areas of pelvic health, but maybe haven't been exposed to as many of those traumatic patients. Because obviously you working in Birmingham Women's Hospital, you're seeing a high volume of those. So I think on the last course, we had some very experienced pelvic health physios, but maybe that they were very experienced in urinary incontinence or pelvic pain, but maybe hadn't seen maybe large amounts of postnatal trauma. Or we also had experienced pelvic health physios who really wanted an update. And then but we also had some new people, and I think it's really important for the new people, because what they can do is, they might be seeing maybe more of the postnatal low back pain or postnatal pelvic girdle pain, but they can then start to pick up, well, it looks like this woman may have an obstetric anal sphincter injury, or it may be that this woman has a fistula, or they may be presenting with symptoms of a levator anal avulsion. And then what those physios can do is they can really signpost those patients to a suitable specialist pelvic health physio in their area. Is that kind of what you're thinking?
Yes, definitely. There was also a question came up for the one was the first course was filling if it's suitable for MSK, and I think if you have an interest in women's health and you see those women postnatally with pelvic girdle pain, it is something that might be suitable. It does cover a lot of anatomy, and it's just a good way of understanding what can happen to those women that you see with pain, maybe without, just postnatally. And postnatal period, it's not just the year after. It's if you had a baby, you're postnatal for basically forever.
Exactly.
And so it's any time that you see them is appropriate to ask the right question, to get the right history diagnosis, and refer them to the right people. So it can be also suitable for those MSK with some women's health interests.
Now, before I let you go, don't disappear. I'm just going to share the program just for a minute, just so people can look at that. So we start off about 9 o'clock, introductions, then we go into perineal trauma, obstetric anal sphincter injury, and wrapped in that morning session, there's also a lot of kind of clinically relevant pelvic floor and pelvic anatomy. We stop for all important tea and coffee. Other drinks are allowed. Then Alina goes into levator anal avulsion, fistulas, lunch and breaks are important because we're doing this via Zoom. It's important to get up and move around. Then that really kind of specialist kind of area that we don't hear really enough about is queefing, vaginal flatulence, and also kind of touching on maybe some of those patients who may be a bit more risk of pudendal nerve injury, maybe post-trauma. Then we go into postnatal pelvic girdle pain, but also, which is a real passion of Alina's, is those women who are really struggling with maybe post-traumatic stress disorder related to the birth process, or maybe postnatal depression. And Alina is really passionate about those and how that impacts on their condition and symptoms. So I'll just stop sharing. And I'll just say a really big thanks to Alina for joining us. And Alina, would you like to say anything before we finish?
Just thank you, Jared, for this opportunity. I really enjoy the teaching, and I really hope to do this many more.
Excellent. And it looks like wherever you are today, the sun is shining.
Yeah.
And during COVID, we all need more sunshine. Okay, so many thanks, and look forward to seeing you in clinic.